The following is a story of male to female transitioner who is experiencing complications and is unable to enjoy sexual encounters after undergoing sex reassignment surgery and subsequent revision surgery. Viewer and listener discretion is advised.
Sorry for the vent. If I had known how many problems comes with my vagina, I'd have definitely opted for zero depth. It is so frustrating, really. I rarely see the complaints I have online. I just do not understand how others do it, or why I have been so cursed, I don't know. After revision surgery 1 year ago and the original sex reassignment surgery 1.5 years ago, I lost around 2 centimeters in depth, and I am around 10 centimeters, which is almost 4 inches. Having sex is just not enjoyable at all. I try to suffer through the pain really as much as I can, but after a few minutes, it is just too much. And the worst, oh my, the worst of all, is that I deal with smells. I get urinary tract and yeast infections almost all the time. I just cannot get on top of it. I spend a fortune on medicine to battle the smell, yeast, fungal, or whatever it is, infections to be healed for a few days before it just returns inevitability. I figured out that dilation is causing the smell, and whatever it is that is happening is also causing the UTI-like symptoms. If I could at least have enjoyable sex, or at least my partner could have enjoyable sex, all this would be worth it. But of course, I had to be unlucky once again.
Here are some of the responses to the post. The link to the original post will be pinned in the comment section down below.
I can help you with the yeast infection and odour problem. I have done a lot of research on neovagina care and made sure to educate myself on any potential issues that comes with one. If you are suffering from yeast infections with odour, you will have to remove the bacteria and introduce vaginal suppositories to your neovagina, particularly lactobacilli-containing ones. This will increase the nonulation of lactohorili in the neovagina to establish a microbiome, healthy vagina tissue, and better smell. Insert one every 3 to 5 days at night. Continue for 3 months before introducing vaginal probiotics. It is always great to do research on something before you go through with it. If you want, I can also recommend you a really good vaginal suppository that comes lube to dilate with. This lube will kill the bad bacteria and help build healthy ones. Additionally, it comes with suppositories.
Thank you for your comment. I actually have lactobacilli capsules in my fridge. They did not seem to dissolve that fast in my new vagina, which is why I stopped using them. I think capsule took multiple days to dissolve. I guess 3 to 5 days makes sense. I just used them wrong, I guess. Maybe you can recommend me the lube? I have one that is good, but very expensive.
I don't think I ever heard of anyone storing them in the fridge, but I assume that you do that for a particular reason. Anyways, I recommend Good Clean Love Flourish Vaginal Care System. It is regarded as one of the best for trans girls. It's a 3-step process that comes a pH balance wash to kill the bad bacteria, the vaginal lube that you will dilate with, and the pack of suppositories. After a month or 3, you should have established healthy microbiome. After that, you can simply use vagina probiotics to maintain it. I forgot to mention that you will also need some pH test strips to see if your pH is in the healthy range.
It was in the instruction to store them in the fridge. Good Clean Love Flourish. Vaginal care system does not ship to my country. I'll try to see if I can import it or find a similar one in Europe. Thanks for your comment, even though it came a bit passive-aggressive. Of course, I'm not just sitting here without doing my research. It's just that everything I tried so far didn't work out.
Oh, I see. If that is part of instructions, then excuse my lack of knowledge. That is a shame that it does not ship to your country. Have you tried Amazon? I forgot to mention that you will also need some pH test strips to see if your pH is in the healthy range. You're also welcome, sister.
Actually, I found it on Amazon. I didn't see it at first because it was sold out, but I should be able to get it once it's restocked.
That's great, sweetie. Good luck with your journey. I hope for the best.
I'm having similar issues. Can you let me know what I need to buy and where, please?
Read my comment above and look on Amazon for it. It's pretty cheap. It is called Good Clean Love Flourish Vaginal Care System. It is a 1-month supply, so try to get at least 2. After a month or 2, you can switch to using vaginal probiotics to maintain your pH balance and microbiome. Additionally, you would want to purchase some Nutriblast Feminine pH test strips. This will let you know if your pH balance is in the good range. Hope that helps.
Would wearing condoms help? No bodily fluids exchanged would mean no pH imbalances or urinary tract infections from interaction with partners, fluids and genital bacterial microbes.
No harm in trying. We didn't use condoms so far, thanks.
I think this would help.
I'm sorry that is rough, and it sounds like a few cisgender women I know. A woman I know can't enjoy sex at all due to painfulness, and she gets urinary tract and yeast infections easy. No fun at all. I can only hope that the discomfort and illness heal so you can actually enjoy what you've tried to do for your body.
Thank you.
Also, to piggyback off this main comment, and this is just a stranger throwing out ideas, so take my idea with salt. Could it be that your partner is giving you urinary tract infections? I saw an OBGYN thing about how this lady kept getting urinary tract infections because of her partner's dirty-ass penis. He never washed himself. Obviously, I doubt it's the scenario for you, but it is something to consider since you may be more likely to get urinary tract infections due to surgery. Again, not saying this is the case or not, but you shouldn't have to live your life in pain due to infection. I know how bad urinary tract infections can hurt. And it fucking blows. Hope it gets better.
Thanks for your comment. Yes, I think we saw the same thread. I just imagine it must have stunk so bad. I don't think it's a problem with us, however, I do not even allow an unwashed hand near it.
We must have. That's good, LOL just wanted to bring that up. As a microbiology student, I am forever aware how many germs are on things and how easy it is to spread them and pass them around.
Since you are versed in that topic, do you think it's possible to get something from public toilet paper? I have a bidet at home, and I could swear every time I use the toilet at my university I get problems.
So is bacteria all around us all the time in real life. So, for a public toilet paper roll, you have to think, hopefully, it is completely sterile when it is made and packaged. Then when the janitor needs to fill the roll holder, they'll need to, possibly, touch the roll, which could transfer germs to the outside film of the roll. As other people touch it to grab their own pieces, I think it's safe to say some germs get brought back as they tear the piece off and touch the roll. Who knows how often those get clean? In short, it's possible, but unlikely. You are more likely be getting an infection from you touching around in the bathroom, then grabbing toilet paper, then wiping. Or it could possibly be the type of toilet paper your school uses that irritates your skin. Public bathrooms are just extremely contaminated with a ton of germs, and it really depends on what you touch and possibly let touch your genitalia, like splash of water from the toilet.
I'm sorry you're going through this. I'm 3 years post-op. Initially, I had 17 centimeters of neovaginal depth, but now I have 2 centimeters depth left due to scarring. Dilating 24/7 and 2 revisions didn't even help against it. We just need to look at this through a positive lens. What we have now might no be ideal, but 100 times better than pre-op. And who knows, maybe in the future we will be able to get a revision that works. And urinary tract infections and yeast infections are quite common in cisgender women. Hugs.
I am so sorry about your surgery. Did you switch your surgeons in between the revisions?
It's okay. I managed to find some kind of peace with knowing it's still better than what I had before. And I would do it again. I had the same surgeon for the 2 revisions because of waiting lists and other doctors not knowing what to do. But I'll have a final revision somewhere this summer where they will swap my peritoneal pull-through canal for a completely new peritoneal pull-through canal or colon canal. Depending on how much peritoneal is left in my stomach area.
I pray that your final revision works. It has to. Also, I agree with your mindset. I would do it all again.
I lost depth too and bleed from the inside and never had sex. It's been over 2 years.
I mean, honestly, I've lost depth, and I'm still glad I got sex change surgery. I think I'd be a lot more dysphoric with 0 depth ignoring struggles with sex.
Thanks for the insight. It's just that sex isn't possible for me, and I doubt that it ever will. But I still have all the maintenance that comes with having depth. I do not feel comfortable yet to just not dilate at all. Problem is that my doctor wanted me to have the ability to get wet, which works. It was a nice thought, but I think that is where my problems with smell, yeast infections, etc. come from. Because I cannot wash with water. I have to keep a healthy flora, which is hard in my opinion.
Why can't you use water? Is it just for the healing process or permanent? How do you wash without water? Hope these questions aren't too much. I'm not as knowledgeable on the male to female side of things.
When I use water, it will stink abnormally. I don't wash inside, just outside. I use lactic acid suppositories to clean it. Something surgeon did to my urethra is the reason why I can get wet when aroused, but also have to try to keep a healthy vaginal biome. Sorry, I am not well versed on surgical terms.
I got 0 depth because I was in my 50s and figured the primary reason I was getting sex reassignment surgery was for me to be at peace with myself and not for sex. I believe I made the right decision and I'm happy with the results. I also knew I did not want to dilate for the rest of my life for something I would likely not use that much. Cost-benefit analysis, I guess. It is such an individual decision that you have to be the one to decide what is best for you. Wishing you the best.
One of the main reasons I won't be getting bottom surgery, even as a transgender male, is because we are not advanced enough to carry out these surgeries with little to no risk. I get people are desperate, and I am too, but when we look at people's stories with bottom surgery, is it really worth that much suffering? I'm very sorry your journey hasn't been a positive one so far. I hope the problems that you're facing will eventually heal and get better with time.
I agree. I mean, aesthetically speaking, I am happy with my results. Even though my sex change surgery didn't go as planned, I am still glad that I got it behind me. Overall, it is an improvement from what I had before. I actually waited 2 years on a waiting list to go to the best doctors in my country. I could have had my sex reassignment surgery a lot soon and also paid extra. The rest was covered. It is easy to say because now I'm smarter than before. If I could go back in time with the knowledge I had, I would probably get the 0 depth option or see a different surgeon, but maybe if I had gone that route beforehand, I'd now make a thread on how much I regret 0 depth and want depth. Being trans just sucks. I hope the healthcare for us improves in that aspect, especially for trans men.
Is it really worth that much suffering? Speak for yourself.
Genuinely, I am. But I would like to remind people that a lifetime of irreversible pain for something that can't function, as bad as the dysphoria may be, trust me, I get it. Sometimes you need to put your thinking head on and see the reality of bottom surgery.
I've spoken to a lot of phalloplasty patients during my own phalloplasty journey and have yet to meet anyone who has chronic irreversible pain. I'm not saying they don't exist, but it seems like it must be the very small minority, if anything. Likewise, I've only met one person thus far who is having trouble achieving functionality, and that shouldn't be permanent. He's still undergoing revisions to fix it that should eventually be successful. Everyone else has been able to achieve the functions they were aiming for, such standing to pee penis into vagina penetration, etc. It's just that sometimes they had to go through multiple revisions to get there. I haven't met anyone yet who has regretted phalloplasty. So I'm genuinely curious, what exactly do you mean about a lifetime of pain for something non-functional? Because that does not at all seem to be the standard outcome people experience. Not for me, and not for anyone I've personally gone along this journey with.
I wasn't talking about phalloplasty.
I apologize if that's not what you meant and I misunderstood, but the context really sounds like you're talking about phalloplasty.
There are many different female-to-male bottom surgeries, and I was shortly bringing my view into the conversation.
It will be worth it for some people and not worth it to others.
Agreed. Even if the procedure went wrong, some people will still be thankful that they don't have their original genitalia. I think it's hard for you or me to comment on that, though.
Yep, the important thing is that people think through exactly what they want and what the options are, not doing something just because it's expected of them or such.
Exactly. I hope my post didn't come around as me saying SRS is bad, do not get it done. I needed to vent about the experience I have and didn't know where else.
You're good. I think it was very clearly your personal experiences. In my opinion, it's also really positive and important for people like you to talk openly about this, as it helps others think through their own future decisions and frames the whole transition thing as individual rather than everyone benefiting from the same exact procedures. Not just the decision of whether or not to get bottom surgery, also for people who do intend to get bottom surgery, because I occasionally see people being dismissive of zero-depth vaginoplasties or of metoidioplasties, not as a personal choice, but in a kind of bottom surgery superiority complex way.
I would kill myself without it, and many others feel the same. I have had moments I seriously considered just being flat because it would be better than this. I don't think you truly understand. I also am in pain every single day, and what God gave me doesn't function.
I'm transgender myself. I wasn't shitting on bottom surgery at all. What I said with the way 99% of surgeries go, you need to make sure you understand exactly what you're going to put yourself through when you sign up for this. I would love bottom surgery for myself in the future, but absolutely no way I would get it with the conditions it is right now. Am I not allowed my own opinion unless you agree with it?
You said a lifetime of irreversible pain for something that can't function, and then you said people need to see the reality of bottom surgery. That sure sounds like you're implying that's a common and likely experience when it's not, and it sounds like a transphobic talking point born out of ignorance or confirmation bias. That's the part that seemed off. The regret rates for bottom surgery are really low. Most surgeries have complications, serious complications are uncommon, so singling out bottom surgery as prone to failure is purposeful. There's no bubble to burst because I'm well aware of risks of surgery as I've already had too. It's easy to notice doomerism. You're totally allowed your own opinion and I'm allowed to have my own opinion disagreeing. I don't recall saying you're not allowed to have an opinion.
Unfortunately, yes, it is very common for there to be complications, not just from people who post online, but for people who don't. If it goes wrong, then it's a lifetime of pain and discomfort, infections and dilation. That is the reality of it. Sorry to burst your bubble there, and while the regret rates may be low, that doesn't discredit anything I have mentioned. If it goes fine or some small complication happens, sure, it can be fixed and they can continue their life fulfilled and happy. It's out of the way.
My comment just got removed for violating the rules? What's going on with this sub all of a sudden?
This subreddit has gone to shit. It's amazing that you're getting downvoted. It's so common to spread falsehoods and transphobe scare tactics about bottom surgery that no one even bats an eye.
My surgeon said to douche it with warm water and a few drops of betadine. I know it's the nuclear option, but it works for me with my penile inversion neovagina. It also removes the dead skin, that white smelly stuff that builds up inside. I took some pics up there after not dilating or douching for 2 weeks due to an unrelated illness. Let's just say I'm never skipping the douche again. There are others on my profile as well if you really want to see what difference a year makes. Honestly, wish I had it done by someone else though. Useless for penetration, and I have no clitoral sensation. I douche mine with betadine and don't have any smells or infections. I tried lots of stuff before I settled on killing everything up there. For colon or peritoneal pull-through, maybe it can support a biome that smells okay, but my penile inversion neovagina cannot.
I'm female to male transgender, so I'm sorry if I sound uneducated or if this suggestion isn't possible for you. But have you tried out pelvic floor therapy? There is a really cool lady on Instagram I follow at Vaginal Rehab Doctor. She does focus mainly on cisgender women, so it's a little triggering for me. I'm pre-female to male bottom surgery. But keeping a healthy nether region is important to me, so I deal LOL. She doesn't seem transphobic, and I have seen her start to adopt trans-friendly language when referring to birthing and all that. Wouldn't hurt to check her out and maybe send her a message.
Stench and pain sounds like it's more from the UTIs than the vagina. I'm with the comments. This is more a vagina issue than a post-op sex change surgery issue. Get you and your partner to a doctor.
Zero-depth vaginoplasty post-op here. I chose this option because I don't like men, but dysphoria still hits me sometimes.
The original poster has since deleted their Reddit account. I hope they are all right. Just a reminder, this video simply voices over the Reddit post and some of the responses and is not meant to be used as medical advice. If you believe you have been harmed by medical transition or want to help those who have been harmed, you can check out some links in the description of this channel. Let me know what you think in the comments down below. Please, don't forget to subscribe, share, and like to raise awareness and to help me out. I have started a new music channel with original music I made in order to help myself and others to relax and to reduce stress. I am including one of the tracks. Link to the channel and the featured track will be in the comments section and the description of this video. Tracks will be available next week on Spotify as well as other streaming platforms. If you like this track, please don't forget to subscribe to my music channels. I will be including an original song after each Reddit story moving forward. I hope some of you who stick around like some of my music.